Hello, welcome back to Sleep Medicine and Physical Therapy, Part 2, Sleep Medicine for the Physiotherapist. Today's topic is Basic Principles of Sleep Physiotherapy Practice. I'm Chris, physiotherapy student. According to the World Physiotherapy, the global body for national physiotherapy associations, physical therapists provide services that develop, maintain, and restore people's maximum movement and functional ability. They can help people at any stage of life when movement and function are threatened by aging, injury, diseases, disorders, conditions, or environmental factors. Physios help people maximize their quality of life, looking at physical, psychological, emotional, and social well-being. They work in health spheres of promotion, prevention, treatment, and rehabilitation. Physios are qualified and professionally required to undertake a comprehensive examination assessment of the patient or client or needs of a client group, evaluate the findings from the examination or assessment to make critical judgments regarding the patient, formulate a diagnosis, prognosis, and plan, provide consultation within the expertise, and determine when patients need to be referred to another healthcare professional, implement the physiotherapist's intervention or treatment program, determine the outcomes for any intervention, and take recommendations for self-management. According to the American Physical Therapy Association of the Position of Health Delegates updated in 2020, physical therapists are part of an interdisciplinary team of licensed health service providers in prevention and management of sleep impairments and promotion of healthy sleep behaviors. The physio's role includes using the best available evidence and standards of practice to screen for sleep dysfunction, identify impairments related to sleep dysfunction, implement and progress therapeutic interventions to address impairments that interfere with sleep, educate society, patients, clients, caregivers, and providers on healthy sleep behaviors and the relationship between sleep, pain, physical activity, function, health, and well-being. Monitor and, if indicated, manage sleep quality and quantity in patients and clients to enhance physical therapy outcomes, and refer to sleep medicine professionals as indicated. Contemporary physiotherapists, who are function specialists and movement experts, need to understand the impact of the sleep deprivation and disorders' singularity on the health and well-being of the patients they attend. In this sense, knowledge about sleep, function, physiology, duration, etc., and skills to screen sleep disorders and promote quality sleep are important components for physios to promote and treat health and wellness. Sleep must be listed within our priorities and be part of the anamnesis and of clinical practice. Physios must guide at the topic sleep more precisely in research and education and in everyday practice. Therefore, the regulations of the physiotherapy in each country is different and depends on the governmental system and healthcare system. PTs must respect local, regional, and cultural differences and act within our scope of practice in an interdisciplinary manner and focused on patient-centered care. Why PTs may treat sleep disturbances. A network of health promotion in life and work has been established in the world of physiotherapy. It encourages the members to forward with their health promotion strategies and share their views and ideas which can be implemented for sustainable development of various problems, such as health acidic problems. Sleep has a vital role in life. In fact, sleep is a behavior that occupies plenty of time in our lives. To be more specific, 1/3 of our life is spent asleep. In this sense, it must have an imperative function, or many functions that we don't know yet for sure. However, we know that we cannot survive without sleep. Sleep is an important protagonist of the proper functioning of most, if not all, body systems. We know it because of much scientific evidence of lack of sleep or disturbed sleep stages from experimental, epidemiological, longitudinal, and trial investigations that shows that we cannot survive without sleep. In fact, since the 1960s, a variety of investigations using animal models have been conducted in order to study the effects of sleep deprivation on the system and organs and to see which would fail first. The researchers found, for example, that after 2 weeks of sleep deprivation, the rodents died from massive multi-organ failure. The cause of death was not clear. The deterioration in appearance, skin lesions, and changes in brain activity resisted simple explication. Several organs failed, and not just one, as they expected to see. These experiments led to a group of researchers to investigate the role of immune function in different organs and systems, and they started to investigate in humans the purpose of sleep. Until now, we know that sleep is a biological necessity and that extended sleep loss reliably produces a syndrome of specific substantial physiological changes. Sleep functions are still a mystery. Impaired sleep affects our overall health. Lack of sleep, both in appropriate quantity and quality, and circadian misalignment have been implicated in numerous adverse health outcomes and can lead to several physiological, psychological, and mental health changes. How PTs may treat sleep disturbances. To incorporate sleep health in PT practice, we must address prevention, health promotion, and wellness interventions. Evaluate general sleep health and screen for risk of sleep disorders. Refer to a physician when a suspected disorder requires diagnosis and further investigation. Arrange for sleep hygiene education. Prescribe an appropriate and individualized exercise program to increase homeostatic sleep pressure and also breathing exercise for some patients. Provide relaxation exercise for patients. Contemplate sleep ergonomics for patients to promote sleep quality. And break the sleep and pain cycle. Contents covered. We covered the physiotherapist's role in the expanded area of sleep, why PTs may treat sleep disturbances, and how they'll do so. I'm Chris, physiotherapy student. Today's topic is Basic Principles of Sleep Physiotherapy Practice. Hope you've enjoyed it and learned something from it. This is Chris signing out.